Can you trust an AI receptionist to speak with your patients? And is an AI receptionist really the best solution for your missed calls problem? I'm Kumar Grant, founder of Verbalise, the allied health and MSK specialist AI company. Today I'm speaking with Rachel Green, the podiatry and physio practice owner, who was the very first pilot practice for our premium AI receptionist. Rachel's had Ivy working in her practice for over a year now. So if you want to hear what it's really like and what value Ivy's bringing to her practice, then please join us for this conversation.
I've been a podiatrist since 2011, and having started off in the NHS, I moved into the private world and now own a 5-room practice in the centre of Hereford. I have 7 members of staff now, and we expect to be welcoming another next year. So we're in a big growth period, and we're always looking for ways to streamline everything we do, be as efficient as possible, and to make sure we're modernising with the world.
And you were one of the very first pilots of our Verbalise AI receptionists. In fact, you were the first. So you got in extremely early, and you really helped to shape our Verbalise AI receptionist in terms of helping to get a really deep understanding of how it might work, in your case, in a podiatry and physiotherapy practice setting. But at the start, when you decided to come on board and be a pilot, what was it you were hoping to get out of this AI?
I think at the time, so this is maybe a year ago now, AI was just kicking off, and it was everywhere. Everywhere I turned, there was articles about different kinds of AI popping up. So I was very aware that we were on the cusp of changing the way we do a lot of things across our lives and across the industry. And I don't like to be left behind. So I was interested in how that could improve our practice and improve our lives. And so I originally spoke to Kumar when the AI receptionist was in its infancy, before anything had really been developed. And you were looking for a partner that you could train the AI reception in to make sure that it was fit for the industry that you wanted to work with, which is the healthcare industry initially. So we got baby Ivy, we called her Ivy at the time, and we got baby Ivy in. We ran loads of tests in-house with the staff, with each other, hundreds of phone calls to Ivy to test how she responded, to really get a grip of how she would sound to our patients. We ran hundreds of scenarios of trying to trip her up, what would go right, what would go wrong. And every time we had any feedback, anytime we did manage to trip her up, we would come back to you, Kumar, and you would tweak her and tweak her and tweak her and tweak her until eventually we were happy enough with Ivy to release her into the wild. And before we did, we then contacted all of our patients to explain what we were doing. And we had almost universal positive feedback from people. A few of the old grumps that have something to contribute to everything had something to say, but otherwise everybody was okay with it. And quite a few of our patients phoned up to have a play with Ivy and just test her out themselves. And then we've gone through a couple of different iterations since then, as we keep pushing back and keep saying, actually, we need her to do this, and there's this unexpected circumstance we didn't think about. Can you find a workaround for this? And every time we've just worked through it until she's able to do what we needed her to. Until we got to the point where I was really happy to say to you, she's ready to go out into the world. And so she has.
Yeah, it's true. You and I don't actually have much communication nowadays about your AI receptionist, which is a good sign. She's kind of working hard, front of office, but as far as you're concerned and I'm concerned, she's doing her job. I remember, of course, in the very early days, when, and again, we're extremely grateful that you were able to help us during that pilot phase, but in the early days, there would be sometimes an issue where Ivy would try and handle a call and it would be too complex, and it resulted in her not being able to fulfill the patient's kind of outcome, and then it would require you jumping on the phone to me, and we had to get it sorted out. AI reception is a difficult challenge and problem. Other AI solutions, things like the AI note-taking, we know that that's taken off extremely quickly across the whole of healthcare. Some of these AI solutions are easier to do. Obviously, when you've got a human being answering the phone, there are so many more ways that it can go. And so developing a really robust AI receptionist service it takes a lot of time and phone calls, because what you find and what we found is over the first year to 18 months, there would be a new phone call where a patient would ask for something in a different way, or someone was phoning and they wanted to book both themselves and their husband in for back-to-back appointments, and at the time that would be too complicated or unexpected for the AI receptionist, and so all of these edge cases then needed to be taken away and the AI trained and new rules and logic put in place, and there's no shortcut to doing that. So it's been a really long process, but we're really happy with where it's got to now. And how do you find working with your AI receptionist now on a day-to-day level?
It's exactly like you described it. I don't speak to you and I don't think about Ivy anymore because she just works in the background. So we have a full-time receptionist, Nick. He has also been involved in training Ivy. So he's really genned up on anything to look out for that she might still be adapting to. We have quite a complicated setup here because we have two services, we have multiple floors, we have out of hours we work. So we are very complicated in terms of how we run. And so there are one or two things that she'll still come across, maybe once or twice a month, but she takes hundreds of calls every month, and the vast majority we have nothing to do with whatsoever. They just work really seamlessly. And we're just starting to get the data coming through, which as a practice owner, that's really what I look at. Nick's happy working with her day to day. The data looks really promising. I am amazed and horrified by how many calls she picks up within our working hours, because Nick is, like I said, full time. He's always answering the phone. He's really good. He never misses a call unless he's gone to put the stock away, or he's with a patient, or he's already on the call. And was absolutely gobsmacked about how many calls he missed despite being really good at answering them. And it just gives me a lot of pleasure knowing that now, if he can't get to the phone, Ivy is there to pick it up. And of course, outside of hours, where normally on a Monday morning, Nick would have had to come in and deal with all of the issues that had popped up over the weekend, people wanting to reschedule, cancel their appointment. He doesn't have to do that anymore now. His Monday morning is quite smooth because everything's just been taken care of over the weekend. And then there are certain circumstances where we know that Ivy is not able to deal with a complex issue, and we're never going to get to the point where she can. So, for example, if she wants to speak to a clinician, or she has a clinical question, a patient has a clinical question, we don't want Ivy to be dealing with that. So she then triggers an email to come to Nick with a transcript of the call, which he can then act on and phone them back. So I kind of feel like everything's covered from every angle. And yeah, it just works now.
Well, that's obviously very happy that things are going really nicely for you. What kind of questions do you think that other practice owners might be having if they're considering it? So I guess at the moment, most clinics are aware that there's an issue in terms of answering calls. Historically, there's been the option to have a virtual receptionist service. What are your thoughts about, or what do you think people need to consider, or what questions do you think people are having when they're thinking of solving answering all of the call questions?
Yeah, I think the two main concerns I had when we first started this was, how are the patients going to respond? Because oftentimes we have an older caseload, particularly in podiatry. I wasn't sure if they were going to be open to AI, whether they were going to slam the phone down as soon as they spoke to them, whether it was going to negatively affect us. And that just hasn't proven to be the case at all. Like I said, they were overwhelmingly positive when I introduced the idea, and then they just had a bit of fun with her quite a lot. And she works so well that it's just not like those horrible list-like machine calls that you used to have to get stuck in, and you get stuck in a horrible loop with them. She's just not like that at all. She's just so natural. She or he, because you can have a male voice as well, is just so natural that the conversations flow naturally. Not to the point where a patient would be fooled into thinking it was a real person, because we wouldn't want that. Just enough that they're not struggling. It just happens one step after the other, and then their concern or their question has been dealt with and sorted. My other concern was how it would impact my staff, particularly Nick, who's our full-time receptionist. And I remember having quite a lot of conversations with you at the beginning, Kamar, to say, Nick's not going anywhere. He is our full-time receptionist. We need a human being, and I don't ever want him to feel like...
A disclaimer. I feel like I was never trying to push him out either. Just in case it gets construed like that.
Might keep him. But now it's really clear that there's two different roles. We need a human receptionist. We need Nick to be that face that welcomes people into the practice, that people can pop by and speak to, that when they come for every single appointment, he's there waiting for them. And they know there's somebody at the end of Ivy if they need to go any further. And we always keep that door really wide open. If they ever ask to speak to somebody, we don't turn them away. Ivy will just say, yep, I'll arrange a call back when it's appropriate, if she can't deal with it. And Nick now sees the value as well, because he sees how many calls she's picking up despite him being there full time. And so that issue has gone away. We're all calm about that now. The machines are not coming to take over. And in terms of a virtual receptionist, so a virtual receptionist I've used before in the past. And I can honestly say that Ivy is trained to know more about our business than the virtual receptionists were, because my experience was I had a team of 6 people who had an A4 sheet of paper with information about our business on, and possibly 2 sides of a sheet of paper, and they were able to respond based on what was on that paper, and that was all. But Ivy has had months of training. She has access to everything that's on the internet, our webpage, so that information has gone to feed into her. She's got access to our SOPs, like everything has fed into training her. So she knows so much. I can't help but humanize her. The technology knows so much about our business that it just dwarfs what a virtual receptionist could do, or even the best, because they just haven't got that space to focus on one business like a piece of technology like Ivy Branch.
I think it's the question, if people are kind of thinking about virtual receptionist versus AI receptionist, it's interesting. It's a good question to have, and it's not that it's always an AI receptionist. What we've found is that in about 85, maybe even 90% of clinic circumstances, the AI receptionist can provide more value and more consistency in terms of how they respond to patients. But we have found, working with a few practices where they were fully reliant on a virtual receptionist service, meaning they had no time to answer the phone nor respond to messages. So if you're working in a practice and you're in that situation, a virtual receptionist service, so a third-party human call centre, is answering the phone, and you don't really have time to follow up any calls, then in that circumstance, at the moment, we're finding that for those practices, AI receptionists don't work for them. And that's simply because there will always be a certain proportion of the calls where it perhaps is too complex, and it's too complex a reason for calling, that the AI won't be able to handle it, other than very politely and respectfully saying, we'll get a member of the team to give you a call back and we'll pass that message on. And so for practices like yours, where Nick, he has the time to look at those emails that Ivy generates and sends to him, and then he, at different points in his day, he can call people back, then it works really well. So I thought I would put that out there to say it's not all of the time that it's an AI receptionist. Sometimes virtual receptionists are best, but we're finding, in our experience, maybe 85% of the time, the AI receptionist has worked better.
I know you're trying to give a fair viewpoint there, but I still think in those circumstances, because I've been in that circumstance, I was in a garden room to begin with on my own. I didn't have a receptionist for the first year, and I used a virtual receptionist, and maybe I had a negative experience. Maybe there are far better ways to do this, but I still ended up having to do lots of the callbacks. And often unpicking problems that had been created. So well done for being fair, but I still am coming down on the AI side.
Well, I appreciate that. It is important for me that, creating content and interviews like this, I'm not wanting to turn it into sales pitch. And, AI technology is still very much emerging, especially AI voice. And so it's absolutely not some perfect utopia yet, but already it's definitely creating enough value, enough return on the amount that practices are spending each month, that they're continuing to do it. And those practices who really kind of embrace it and help us to customize and shape their IVs or Archies, or whatever they choose to call their AI receptionist, the ones that really help to shape it, then their AI receptionist kind of beds in. And then, again, just as it's been with you, to begin with, over the first month, we're really heavily involved, customizing and helping their virtual receptionist to understand their clinic and how they want to speak and the voice and the tone. But after a month or so, then we don't have much contact other than, a few months later, I'm, checking in, hey, how's it going? But really the AI receptionist is just doing their thing and the clinic is comfortable and they know how it works. You mentioned value. I think from my perspective, speaking with practice owners, cost has often been quite a big concern for practices. Now, at Verbalise, we create a premium AI receptionist, and that means that people are paying more than they might some of the AI call answering services, which you can pay quite a small amount for, but in our experience, it doesn't allow for our human, relationship that we build with a practice, getting to understand what they do, customizing a lot the AI receptionist. And so for us, and it might be good to hear you speak to this a bit, the main value that we're finding clinics talking to us about of an AI receptionist is winning new patients. Meaning, if you're missing a call, and that call is someone who's gone on Google and they've said, physiotherapist, Hereford, Google brings up the Google Maps and you've got three or four, five, and depending on the city you're in, you've got 10 options in front of you. You try the first one, the phone doesn't get answered, you move on to the second one. And so the value we're finding is often, what is the value of a new patient to you? Because that...
Well, I can definitely talk about that, because over the years since I started the clinic, I've spent a lot of time on optimizing how our staff work, how everybody in the building works. And in terms of reception, that looks like spending time with our receptionist to train him about exactly what happens in a PT class. He'll sit in a PT, personal training class, so he really understands what it is. I have a go at PT himself. Talks to the clinician. We develop SOPs for how the appointment runs and how the follow-up runs. So our receptionist, Nick, he knows everything about every single appointment. And it's not just, yes, we have a PT appointment available, would you like to book it? It's when the patient, prospective patient calls up, he's ready to explain what the value of our services are to that patient. So he won't say, yes, the price is this, book in. He'll say, yes, in a PT session, this is what happens. Our physiotherapist, Shahan, is extremely experienced. He'll take you through this. He'll help you talk through your goals. And he has a whole, it's not a script for us, but it's a whole spiel of what he's picked up through years and years of working with us now. And he knows our services inside and out. And a virtual receptionist or the simpler AI call takers don't have that access to information. But because we've helped to design Ivy or Archie, whoever you're speaking to, we've embedded some of that learning into her already. So when she comes to a new clinic, she'll already have that training that you have worked to put into her back office system. I don't understand the complexities. So that she automatically knows she doesn't just give the price straight away. She talks to the patient about what will happen in the appointment and why it's valuable to them. So to start with, she automatically gets more bookings for us than an answer phone machine would or a call taking service would get, because she does everything that we do. And then once she books them, we consider the value of each new patient to not just be the cost of the first appointment, but to be the lifetime value that we'll gain from having that patient with us. So a lot of our patients stay for years with us, some stay for 6 months, and we have a way of working out exactly how much a lifetime spend for each of our patients is likely to be. Yeah. And for those of you who look at this sort of stuff already, that's exactly the same sort of cost analysis that you do with marketing to figure out when you're paying for marketing, if you spend £10 on marketing and get one new patient back, that over the lifetime will spend £1,000, you know you've made £990 from that £10 of marketing. So we look at Ivy in the same way. And luckily, we're able to draw data from the dashboard, which is being developed all the time, to sort of see how much we're spending and how much we're gaining back. And it's just really, really clear. I mean, of course it's clear, because we would have missed those calls for a start. And now, I was picking them up, and they're making bookings, and we're seeing the revenue. So over the last few months, she's made, thousands of pounds for us, over £10,000 for us. And we're in a quiet period of the year for trading where we are. So it's just obvious, really. We couldn't do without it now. I wouldn't want to go back to not having it. It wouldn't make any sense.
I think that's useful to kind of spell out. So I think a possible misnomer that people approach AI receptionists with is thinking that the saving is going to be, I'm going to replace the human with the AI receptionist, so I'm going to be saving on the cost of a full member of staff. And that's not how it's working. That the main value add is capturing new patients, and the lifetime value of those patients who come to you rather than receiving, an answering machine and going on to a competitor. Ivy does save time. She will handle calls completely, but she'll also take complex calls, and that will require a callback from the human member of staff. So there is a time saving, but it's not. I think it's a mistake if people go into an AI receptionist thinking it's going to be a complete replacement for a human, and it's going to save an entire person's working time. That's not where the value add is.
It definitely can do that, because I look back at when I first started and think I got a receptionist after a year, and I was absolutely terrified at being responsible for someone's enormous salary when she wasn't going to be earning any money for us. And so back then, I would have loved to have had an AI solution to bridge the gap to the point where I was ready to get a receptionist. But you're right in that is a small period of time in the growth of a business, and over the lifetime of a business, it's looking at the new patient value that really gives you the value.
Yeah, you're right. An AI receptionist can be really valuable for those practitioners who are, for example, trying to do all of the actual practice work and then take the calls, and they can't, so they're having to, it's going through to voicemail, then they're missing some of those calls. So it is valuable there. But for more mature, larger clinics that do have a human receptionist, I mean, I'll say that we've got practices where people they've said that having an AI receptionist has maybe allowed them to not get a second part-time member of staff. It can allow for some degree of scaling without an additional hire, but in most of the practices where we're finding practices are getting the most value from the AI receptionist, they still have their human receptionist, just like you guys. So, right, Rachel, have we forgotten anything burning that a practice owner who's considering an AI receptionist might want to know?
Not that I can think of, but my emails are always open. So please feel free, maybe put my email address in the notes of this meeting, Kamar, because I'm happy for anybody who's got questions to just pop me a line. I mean, don't ask me anything technical, because that's all Kamar's area, but if you just want to know how it has settled into the practice, I'm very happy to talk about it with anybody.
Well, thank you very much for that offer. I will just invite people to private message me, and if you are wanting to speak to Rachel, I will privately share your email address. But Rachel, thank you so much. I really appreciate your time today. As I was saying at the beginning, as I awkwardly set this up, this was the first time we've done something like this. So thanks for being a crash test dummy. I think it's gone well, so thank you. But yeah, thanks again for your time, and I look forward to seeing you soon.
Bye.
Take care. Bye now.